Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Why does PeptoBismol turn your tongue black? Bismuth, found in the active ingredient in PeptoBismol, interacts with sulfur found naturally in your mouth and digestive tract to create bismuth sulfide, a substance that may turn your tongue black. It's a harmless side effect and usually clears up a few days after you stop treatment. The active ingredient in PeptoBismol is bismuth subsalicylate. The interaction between bismuth and sulfur can also cause your stools, poop, to look darker or black, which is also a temporary and harmless side effect. If your black tongue does not go away in a few days, or you notice a black tongue or darkened stools but you have not used PeptoBismol, contact your doctor for evaluation. Dark stools or a black tongue can also be caused by certain medical conditions or other drugs. How do you get rid of black tongue from PeptoBismol? A few days after you stop using PeptoBismol, your tongue discoloration should go away on its own, so you don't really need to do anything. PeptoBismol is usually out of your system in one day, but it can take several days for the side effect to go away. Does PeptoBismol cause black hairy tongue? A pseudo-black hairy tongue, that mimics the look of black hairy tongue without the elongated cells on the tongue, can occur from using products containing bismuth like PeptoBismol. Other products that can cause pseudo-black hairy tongue include certain foods, tobacco and medicines like antibiotics or antidepressants. You should continue to practice good oral hygiene by brushing twice a day and flossing. Gently brushing your tongue with a soft bristle toothbrush may help to remove any discolored or dead cells on your tongue, although you should not have any elongated tongue cells with PeptoBismol use. Related: what causes black hairy tongue? Related questions: can you give PeptoBismol to kids? Does PeptoBismol help with diarrhea? How long does it take for PeptoBismol to work? What does PeptoBismol treat and how does it work? PeptoBismol is an over-the-counter, OTC, medicine used to treat diarrhea, traveler's diarrhea, nausea, heartburn, indigestion, gas, or upset stomach. It's available OTC as a liquid, tablet, capsule, chewable forms, and gummies and can be found at most retail shops and pharmacies in the US. PeptoBismol works by preventing secretions in your intestinal tract, increasing fluid reabsorption, and decreasing inflammation and bacteria growth that may contribute to diarrhea. What is the main ingredient in PeptoBismol? The active ingredient in PeptoBismol is bismuth subsalicylate, a compound that is chemically related to aspirin and contains similar warnings. PeptoBismol is indicated for use in adults and children 12 years and over. Always follow the label directions and drug facts found on the package. Children, adolescents and even older teenagers who have or are recovering from chickenpox, flu or flu-like symptoms should not use PeptoBismol due to the possible risk of Reyes syndrome. Reyes syndrome is a very serious illness that may rarely occur in children who have used salicylates. It may lead to permanent brain damage or death in children. It requires immediate medical treatment. Changes in behavior, extreme tiredness, confusion, nausea or vomiting or seizures may be signs of Reyes syndrome. Contact your doctor right away or call 911 if your child has taken PeptoBismol and you notice these symptoms. You should not use bismuth subsalicylate, PeptoBismol, if you have bleeding problems, a stomach ulcer, blood in your stools, or if you are allergic to aspirin or other salicylates. This is not all the information you need to know about PeptoBismol and does not take the place of your doctor's directions. Discuss any medical questions you have with your doctor or other healthcare provider. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.